Good evening. I'd like to call the meeting to order. And I'll ask the board secretary to conduct the roll call.
Member Banham?
Present.
Mom Cloutier? Member Di Giovanni?
Present.
Chair Aglai?
Present.
Member El Shantari?
Present.
Member Gower?
Here.
Member Kavanaugh?
Present.
Member Lakin?
Present.
Member Menard? Member Pinel?
Présente.
Member Tilley? You have quorum, Mr. Chair.
Thank you. And Member Tilley has sent his regrets for tonight. Are there any declarations of pecuniary interest?
Yes,
Member Lakin.
Yes, Mr. Chair, I have a declaration to make that I, Member Lewis Lakin, declare a deemed pecuniary interest on Ottawa Board of Health Agenda 3, Item 3, 2019 Draft Operating Budget for the Ottawa Board of Health, Document 1, page 5, Ministry of Health and Long-Term Care Programs and Standards, Chronic Disease Prevention and Well-Being, and City-Funded Programs, Mental Health, Substance Use, and Injury Prevention. As a family member is a public health employee working in these areas.
Okay, noted. Could we have a confirmation of the minutes of February the 4th, 2019, please? Thank you. We have 4 communication items which have been received. Member Pinel, if I could ask you to move the motion to introduce reports.
Yes, Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled 2019 Draft Operating Budget for the Ottawa Board of Health, Let's Clear the Air, LCA 3.0, Ottawa Public Health Submission to Health Canada on proposed regulations for cannabis edibles, extracts, and topicals, and update, consultation on opioids, substance use, and mental health in Ottawa be received and considered.
Thank you. Carried. Carried. Thank you. So I'll just run quickly through the agenda, and then we'll go back to the matters that we hold. So first is the verbal report from myself, so we'll come back to that, followed by a verbal report from our Medical Officer of Health. Item 3 is the 2019 draft operating budget for the Board of Health, and we have a short presentation from staff on that, so we'll hold that as well. Next is Let's Clear the Air. Item number 4, again, we have a presentation, so we will hold that. Number 5 is Ottawa Public Health Submission to Health Canada on proposed regulations for cannabis, edibles, extracts, and topicals. We don't have a presentation, but we have staff here prepared to answer questions. I know I have some questions, so and I'm sure others may as well, so we'll hold that as well. Item number 6 is the update consultation on opioid substance abuse, or substance use rather, and mental health in Ottawa. Again, there's no presentation there, simply a recommendation that the Board of Health receive this report for information. Does anybody want that held for questions or discussion? Okay, receive then. All right, so back to item number 1, which is my verbal report. So good evening, everyone. Bonsoir. For my verbal update this evening, I'd like to begin by highlighting my recent visit to Ottawa Public Health. During this visit, I had the opportunity to meet with OPH staff and learn about OPH programs and services. I got to meet with several program managers from the health promotion, health protection, and communication and community engagement teams to discuss the public health services offered and how their teams are managing their jobs with professionalism. Not only did this visit provide me with insight into the amount of work that gets done behind the scenes, it also gave me an opportunity to acknowledge the individuals performing this work. And frankly, it gave me an opportunity just to see the energy around public health. It's a truly well-knit team, and I crammed a lot of information into my head in a couple of hours. So if I'm back there and I don't remember your name, I apologize. But it was very, very informative, and just all the different pots that we have our fingers in, so to speak. That's no pun intended for later discussion tonight, but it's truly quite amazing. And so I want to thank all the employees for orienting me to the things that they do on a regular basis. As many of you know, and will have heard, last month, Councillor Jeff Leeper suffered a heart attack while shoveling snow. He was rushed to hospital to receive the care he needed and is now thankfully recovering. As a lifelong smoker, this incident caused him to make the decision to quit smoking. Councillor Leeper has chosen to use this opportunity to shine a light on the importance of maintaining a healthy lifestyle and to inspire others to make healthy decisions. I'd like to thank Ottawa Public Health for continually raising awareness about the harms of tobacco, for always promoting healthy choices through its social media platforms, and for offering services and resources to help people quit smoking. On a personal note, Councillor Leeper and I had actually been talking about smoke cessation a couple of weeks before he had his heart attack. And I was explaining to him about the various programs available through public health. And he said he would think about it. And then he called me the night that he had his heart attack, and I didn't know that. And I said, Jeff, how are you doing? He said, well, I decided to take you up on your offer for public health support. And I said, oh, that's great. I said, what changed your mind? He said, well, I had a heart attack this morning, and I'm at the Heart Institute. So, I know the public health team is very pleased and to be there to assist and to provide him with assistance. The other note of interest, at least to me, is for some strange reason, people in the public sometimes mix Councillor Leeper and myself up. Today, two total strangers came up to me on the street and wished me well on my first day back to work, and cautioned me to take it easy and not do too much. So I did share that with Councillor Leeper's office, and his staff thought that was quite amusing. But I'd like to share some words from Councillor Leeper now. As I say, it's his first day back to work, so he is taking it easy and he's not with us, but we're going to share his video message with you.
My breath just got really shallow. I had this weird pain all through my jaw and in my back. I couldn't catch my breath. I was quite dizzy. So we called the ambulance and they brought me in here. About 20 minutes after I got into this room, after the angioplasty, the folks from the smoking cessation unit came in. I think they told me something like, so you're a non-smoker now.
So when an individual's had a heart attack or had any kind of a cardiac issue, job one is to help them stop smoking. The one thing I think it's very important for everyone watching this to understand is that smoking isn't a habit. It's an addiction.
I don't think I can do it alone, and my message to those who may be watching my story and thinking it cuts or hits a little bit close to home is, hopefully you don't wind up here before asking for help. Overwhelming. It's very overwhelming. Quite a wake-up call. Thank you. Just wonderful care. I can't say enough. Thank you so much. Thank you. Have a great afternoon.
I'd like to thank Councillor Leeper. He's not here, but I'd like to thank him for sharing his story with us. Very important message, and we're going to continue to work with him and support him in his journey. As you know, Ottawa Public Health is also a member of the Association of Local Public Health Agencies, otherwise known as ALPHA, a nonprofit organization that provides leadership to Ontario boards of health and public health units and lends expertise on the governance, administration, and management of health units. The association also collaborates with governments and other health organizations advocating for a strong, effective, and efficient public health system in the province. Membership includes Board of Health members, medical officers of health, and associate medical officers of health, as well as senior public health managers. ALPHA held its winter symposium on February the 21st, 2019. Member Cloutier took that opportunity to attend the meeting to learn more about public health's role in mental health and to discuss emerging issues provincially. And I'd like to thank Member Cloutier for doing that. I had hoped to attend in my role as chair, but that was also the day that we were tabling the Community Protective Services budget, of which I'm also the co-chair of that committee. So I asked Member Cloutier if he would be prepared to attend, and he readily said yes, so thank you very much for that. And I'd like to invite you, if you would, to provide a verbal report on your attendance at the symposium.
Merci, Monsieur le Président. Thank you, Chair Eglai, and it certainly was my privilege to attend on your behalf and to represent OPH at the ALPHA symposium on February 21st, and thank you to Dr. Etches and to Mr. Kirkpatrick for helping me. They also attended, and I think they would have found it very beneficial. You know, as the provincial government seeks to fulfill one of their highest order of election promises, which is to end hallway medicine, as they have said it, we need to make sure that we in public health have to make sure to continue the focus of ensuring that all the stakeholders, the funders, the provincial government, know of the importance of public health and the value in immunizing children, in early childhood development and health care, and in mental health addictions. And the money that's invested in public health saves money to the health system later on. And I'm sure we're convinced of that here. On l'est convaincu de ces faits ici. But it's good to remind people and to share that message and to coordinate with our other colleagues in public health in the province of Ontario. There were several very interesting sessions, and one in particular on mental health and the connection between the mental health system and public health. And we were able to discuss and look at the science gaps and the justice, which also is the financing gap, and the advocacy gap with respect to mental health, and how mental health is still viewed so differently than other aspects of health, and that has to change. Mental health is health. There was, a matter of fact, there was a slide to that effect. Mental health is health in the presentation, and mental health. One thing that struck me, for example, I won't take up too much time. Mental health, first aid as preventative, it was an interesting concept that I think is worth exploring. There were other sessions, such as the liability issues that this board faces and that Ottawa Public Health faces in exercising its responsibilities. And when we're looking at Walkerton or the Creever Inquiry and tainted blood, it's important to keep those in mind. And as we had our session Monday a week ago, it was, and we talked about our liability and our responsibility. How important that is, and there was a very good session on that. They distributed, ALPHA prepared an orientation manual, 2018 orientation manual for boards of health. I think it's on the alphaweb.org, and I would encourage my colleagues around the table to download it or to have a look at it. It's a good source of information that will help us in the exercise of our duties. And with that, Chair, thank you again for asking me to be there on your behalf. It was a privilege to have attended, I look forward to meeting up with the others in the province again shortly.
Thank you, Member Cloutier. Perhaps the Secretary could circulate the link to the document you're referring to, so everybody can have access to it easily. And as you know, ALF will be holding its annual general meeting and conference on June 9th to the 11th. Members have until March 29th to submit their expressions of interest, and I would encourage all members to attend at least once during their term. That concludes my verbal report, unless anybody has any questions. I'm going to ask then Dr. Etches to provide her verbal report. Oh, sorry, and receive my verbal report? Thank you.
Okay, thank you, Chair. Good evening, bonsoir, Kwe. I want to begin by thanking board members who participated in the session that Member Cloutier mentioned, our orientation session for board members that was held on February 26th. We discussed the legislation that governs public health, provincial accountability framework that guides our work and health units, and key areas of our work that will continue into the future. And this work, one of the key areas included discussion of the rationale for acknowledging that we do our work on unceded Algonquin territory. And there was support to continue to work on reconciliation with First Nations, Métis, and Inuit peoples to promote the health of all people in Ottawa. And today marks the public launch of the city's official plan. This official plan will prepare us for the future by guiding how the city grows and develops. It shapes the places where we work, live, and play. And this includes where growth will happen, how natural areas are preserved or accessed, the planning of infrastructure, and planning for new communities, as well as existing communities that are undergoing change. La façon dont la ville planifiée, l'aménagement aura un impact sur la santé et le bien-être des membres de nos communautés à l'avenir. And promoting healthy built environments is about creating conditions that allow people to be healthy and thrive. And as our city continues to grow and become more diverse, the new official plan will have to keep pace to ensure that we grow to be a healthier city and more livable. So the official plan review was launched today through the release of a series of discussion papers on broad issues to consider as the city grows. And we're pleased that one of those papers was led by Ottawa Public Health. It's called The Building Blocks for a Healthy Ottawa. And this paper describes the health implications of the way communities are built by exploring issues of transportation, housing, food systems, the natural environment, and neighborhood design. It outlines the ways in which communities can be planned, built, and used so that people have more opportunities to lead healthy lives. The official plan, in fact, can be a policy prescription for health. It can be an important piece of the puzzle to reduce chronic diseases and injuries, to promote mental health, and to decrease exposures to environmental hazards. Il est excitant de constater que la santé est l'un des principaux problèmes sur lesquels la ville souhaite s'investir pour informer le nouveau plan officiel. So Ottawa Public Health looks forward to continuing to contribute to the plan review process by providing this perspective of how communities can be planned in a way that is mindful of and concerned about the health of the population. Ottawa Public Health works with the city on many things, many initiatives, and another critical area of collaboration is for emergency preparedness and response. We do know that warmer weather is likely upon us, so it's hard to believe some days. And given the amount of snow we received this winter, the Ottawa Public Health team is working with the city as members of the 2019 Spring Freshet Task Force to prevent, mitigate, and help manage any risk of flooding this year. The meetings are scheduled, and Ottawa Public Health is actively engaged in updating communications products, education material, and other supports to prepare residents. Next, I'd like to bring to your attention our successful Ottawa Summit on opioids, substance use, and mental health, which was held on February 7th. The summit was a joint initiative with the Royal and Ottawa Public Health, where we brought together over 200 people, including those with lived experience, clinicians, researchers, educators, police, paramedics, funders, and people working in social services. Member Lakin joined us for some of the conversation that day. And the event provided an opportunity to gauge the current state of mental health and substance use approaches with a focus on addressing the risks of opioid use, and to identify and prioritize future opportunities for collaboration across the sector. Participants voted on the top 3 areas for action in 3 categories: preventing stigma and problematic substance use, emerging harm reduction initiatives that can reduce harms associated with opioid use, and collaborating and integrating across the health system to increase access and uptake of services. There is a summary report that you accepted tonight. So addressing the opioid crisis under a framework to improve mental health and substance use more broadly is a unique approach that we're taking in Ottawa. And the commitment from people across so many sectors and people with lived experience was really inspiring. So I look forward to sharing with you how this will lead to further actions and collaboration. It will be interesting for us to see how the ideas fit with the provincial priority to invest in mental health and substance use. And speaking of the province, there have been significant plans to shift approaches to health system governance, planning, and funding that have been announced recently. There are no changes for how Ottawa Public Health is governed or operated that have been proposed, and we'll continue to monitor the evolving approach and keep you up to date. Ottawa Public Health's focus will remain preventing injury and disease, improving the health of the population, and protecting the health of our population, with attention to populations that face greater barriers to health. And partnership with the healthcare system will remain important as part of this mission. Chair, that concludes my verbal report. I'm happy to take questions. Merci.
Member El-Shantiri.
Thank you, Mr. Chair, and thank you, Doctor, for your report. Doctor, did I hear you correctly saying you are on working with the emergency preparedness for the flooding or potential of flooding in our community? So are you on a table with the emergency responders?
That's correct. We have a manager who focuses on emergency preparedness and response, and she is the representative for Ottawa Public Health in those preparations.
Would also that the individual who represent public health will be taking in consideration the food preparedness and other in case of flooding, perhaps, you know?
Yes, when I hope we don't need it.
Trust me, nobody wants more than that.
That's right. If needed, one of the aspects of information that public health can provide to support health following a flood is around food safety. And there is information already available. We're looking at it to see if there's any updates needed. It's also something we're planning to get out to councillors across the board. I think there's no reason to wait in terms of sharing with councillors' offices ahead of time the kind of materials that could be useful related to food safety.
Well, I believe this is all helpful to be out in the public beforehand, not after. I would prefer. My other question is, thank you for that. Perhaps the other question, when you talk about healthy living and the new official plan, and what does it mean to us for the next perhaps 20 years, have you had any focus on the organic farms? It's been growing in a rural area. Is there any connection between public health, organic food coming to the city within 100 kilometers from? So have that been on your radar of discussion?
Yes, I'll flag for Jillian if she wants to speak to more of our work in this area, but Ottawa Public Health's Healthy Eating, Active Living focus includes thinking about our food system. And there are different challenges that the team is working with many community partners on. One is access to food, making sure that people, where there are barriers to having enough food, the right kinds of food, that we can find community solutions for that. But the food system also it relates to food supply and what can be done locally. Whether it's specifically organic or not, I would say we don't have a specific focus on organic versus conventional food production, but rather the whole food system and making sure people do have access, and there are ways we can strengthen the food that's produced locally as a system. If you like, Jillian, would you like to add? No, that's fair. Does that answer your question, Councillor? Or Member El-Shantari?
I would like to see, same as the flood, I like to see our folks from the public health involved in the plan and not just showing when something happened. Like we like you to, so we had a report perhaps on the flooding, lesson learned. What did we learn from the flood? And so I hope your staff has reviewed those recommendations. And also when it comes about food and where the food's coming from, and especially with the new official plan, I think it's good to focus our involvement on healthy eating, healthy living, because the food is coming from our own community. Ottawa is 80% of it is rural. We grow almost everything in it. So that kind of, I like to see ourselves part of that discussion.
Okay. So definitely in the planning paper that we produced about building a healthier city, food and food systems is one of the subjects that we have in that document, and thank you for reinforcing that that should be an area that we continue to raise our voice in as they look at the development of the plan.
Okay, thank you, Mr. Chair. Thank you, Doctor.
Any other questions? Member Kavanagh.
Thank you very much. I just want to say I'm really happy to hear that you're going to be involved in the official plan. I actually thought that the word healthy should have been in that little tag when they're talking about a livable city. It should be a healthy, livable city, and I'll still push for that. But there's so much we can do, and I'm glad that you're looking at that in terms of a part of the plan, because it all fits in. That's why I'm here. I see our role as in terms of you know, active transportation, other things that we encourage as being very helpful to be part of that subject. So I'm glad that there'll be full participation. Thank you.
Any other questions? Okay, can we receive the report then? Okay, thank you very much. Next is the 2019 draft operating budget for the Board of Health. And again, we have a brief presentation on that, and then staff is present to answer any questions you might have.
Alongside me, I'm trying to say, is Samantha Gosson, who's part of my team on the financial side and has provided me with great support through this process. Thank you, Sam. You will recall that when we tabled the budget with you on February 4th, we communicated several avenues for residents and stakeholders to submit questions or comments on the draft budget. This included a dedicated email address, a telephone number, and social media. I can report that as of this afternoon, no communications have been received through any of these avenues. Tonight, as you consider the 2019 draft operating budget, we'll provide a brief overview since our last meeting. There have been no changes to the 2019 assumptions. The city is providing a 3% increase, or $610,000, which aligns with the city guidelines for the 2019 budget development. The budget assumes that the province will be providing a $630,000 increase on cost-shared programs, which represents a 2% increase. And overall, there's a base expenditure increase of 2.4%, which consists of costs of living and benefit increases, lease cost increases, and fleet costs. Next steps, once the board approves the budget tonight, it will rise to council on Wednesday, March the 6th for final city approval, and then be submitted to the Ministry of Health and Long-Term Care for consideration. We welcome any questions at this time.
Thank you, Lou, and I appreciate your enthusiasm, and you didn't say if we approve the budget, you said when we approve the budget, so that's the kind of thing I like to hear. Are there any questions? Member Cloutier.
Thank you, and thank you very much for your presentation. Can you go back just a couple of slides, just a précision that jumped out right there. Few percent increase. I think does the budget document say 810,000 as opposed to 610?
Yeah, that's correct. There's 610 is for a base increase. The additional $200,000 is contingent on ministry funding for one-time programs.
Okay. Okay. Thank you. I just had one question as I look through the budget, and knowing that budgets are the way we put forth our objectives and our strategic objectives in our organization. Cannabis. I'm sure there will be a lot of additional work with respect to cannabis and the regulation of cannabis, both in retail and online. Can you give us a little how this work will be funded, and how we'll attain those objectives?
Sure, Member Cloutier. The team that is addressing mental health and substance use addresses cannabis, and we have two broad areas of work. One is around health promotion, and the work we do to make sure people are informed and making informed choices, they understand the impact on health, and also we try to decrease use, especially among youth, prevent initiation, help link people to treatment if they're running into problems. So that health promotion work is significant. You're right. It's a lot. Some of that is new work. We're keeping track of our costs, and we expect that some of the revenues that will come from the sale of cannabis that comes to the city will be able to support some of that work. The other second large area of work is related to the protection side, the health protection work that we do, which is about protecting people from secondhand smoke, and so looking at where people can smoke cannabis and enforcing the regulations. That's work we carry out actually through bylaw, through the city. I think that most people's understanding of how that enforcement works is in the city is correct. It's bylaw that's on the ground doing that work, but we fund that out of our budget. So right now, there's an expectation that the need for further enforcement is there, and that is a budget pressure. Again, we have the avenues of asking the province for one-time funding to offset that pressure, and also the revenue that will be coming to the city is another place we expect to be able to offset some of that pressure.
So hope the province had said that they would fund cities $40 million with respect to the rollout of cannabis. We and the City of Ottawa will get some of that money. We at OPH should expect to receive a slice of that money to help with our budget.
In speaking with city leaders involved in the coordination of the response, because many city departments are affected by the change in legalization of cannabis, the conversation has recognized that there's a pressure on Ottawa Public Health, and that is one area they need to be looking to support.
Okay. And you spoke about briefly, or at the beginning, there will be additional educational material that will go out with respect to cannabis, and hopefully reducing cannabis use, or educating parents or young people or potential cannabis users on the...
You're correct, and that is the subject of one of the other reports with the emergence of edibles becoming part of the legal supply. There are new health messages that we need to get across around some of the qualities and impacts of consuming edibles. And then our work will continue building the youth-to-youth approach. So there's a general population message. It's important for everyone to understand how edibles work, and then really the focus on youth has been our priority, and we'll continue that work.
Thank you. Thank you.
very much. Member Gower.
Thank you. The budget assumes 2% funding from the province. What is our level of confidence in that? And in a worst-case scenario, what if it came in at less? What would be the contingency, or how would the public health unit react if there was less funding than anticipated?
Well, our budget's made up 85% of staffing costs, so we were faced with a similar situation last year, where we assumed a 2.5% increase at that point. The ministry came in at 0. So we had to look at staffing. We undertake a continuous process of reviewing vacancies, and we manage within our envelope of money. So there's not much non-staffing dollars in the budget, and the funds that are there are required in order to run the program. So ultimately, if that's what we're faced with, we'd be looking at vacancies and trying to rebalance the budget through attrition and vacancies.
So it wouldn't prevent the public health's ability to deliver the programs and services that would be managed other ways rather than cutting services. Is that correct? Correct. We'd be looking at a back office and supportive roles, and staying away from frontline services. Okay. Thank you.
Thank you very much. Member Menard.
Thanks very much, Mr. Chair. My question relates to what I asked around the first time this document was distributed, and it's around the potential reductions to provincial programs in the AIDS Bureau, the supervised consumption services. It's on page 4, I believe, of the budget binder under supplementary programs. And I was pleased to have a great conversation with Mr. Hendricks as well about this previously, so thank you for the information you've passed along. I'm just wondering, is this for the 4 sites that Ottawa currently operates? Is that what these are, or is this separate to that?
Thank you for your question. The change in the reduction in the budget here is an adjustment made for one-time funding. And so what you're speaking to is a vulnerability that the funding Ottawa Public Health receives for supervised services, what we're shifting into calling consumption and treatment services, is a request that's still before the province. Okay. And it's only for our site. So there are 4 consumption and treatment services sites where that service is being offered in the city. One is run by Inner City Health, one is run by the Sandy Hill Community Health Center, another's run by Somerset West Community Health Center, and we run the 4th, which is in the market on Clarence Street. So it's only the funding for our site. And yeah, so that's what shows up there.
Okay, so that's very helpful, because it's it's not a small amount of money. It's almost $1 million change in the budget to our detriment. And so when do we expect we may hear back from the province on it?
Anytime now, soon, spring. We do have a deadline coming up at the end of March. That's where our current funding goes until, and the ministry's been in communication back and forth. We know they're active on this.
Okay, so it could be a positive news story for us, or a good news story if it does come in, because we'll be to the positive. And I note that back in October they did announce they'd continue funding sites such as these, but maybe a different focus in terms of priority. So that seemed like a good indication then that there would be funding coming in for these types of sites. So I'm hopeful that that we do see that. Thanks.
Thank you. Member El Chantiri.
Thank you. My question actually was asked by Member Gower about the provincial increase. Have any discussion been taking place with the province beforehand to know if 2% is going to be accepted or something they would agree to?
Yes, so there are informal conversations. Lou makes phone calls to people and they chat in the ministry. I would say we are getting signals that 2% may be optimistic. Okay. And we could look at 0%. It's possible. I mean, we can use every dollar to expand service. The needs are there in the community. We would like to have what we've requested of the ministry, and so we need to ask or we will never get it. So that's why we put in 2%. It's not being unrealistic. It's saying, look, we have these needs in our community. On the realistic side, we won't spend the money until it's confirmed that the province provides it. And that means holding open 5 or 6 positions. And then, as Mr. Flabourier said, if we need to balance our budget to what the province actually gives us, that means we have to probably remove 5 or 6 positions, which we have those vacancies. We usually have with retirements, with moves and shifts over the year. We can usually quite easily find 5 or 6 that become vacant.
Okay. And the other question, I know I should have asked that during orientation. So, so this is our budget from the city, and you get matching dollar from the province, is that or not for everything? I know we should.
The vast majority, that's how it operates. And we call those cost-shared programs, where for every about roughly 25% that the city puts in, the province puts in 75%. So for that's the cost-shared portion. Then there are smaller amounts of the budget where the province pays 100% for a program, like a lot of our healthy growth and development work, for instance, and some of our infectious disease prevention and control work. And then there are some pieces, smaller pieces of the budget that the city funds. The city has told us, formerly the city council has said mental health is a priority in our city, and so there are 100% dollars in the budget where we are supporting that city priority.
So there's, it's not cut and dry, basically. It's not, so it's a different program, different infection disease, whatever, but different funding model for every program we have. Is that fair to say?
Yes, it is a complex way of putting the budget together, but in the end, the way we present it is the increase in contribution from the city is that increase of 610,000. So whether that's cost shared or 100%, that's the total increase from the city. And the same with the province. When we put it all together, the increase from the province is the 630.
Okay. My other question, during the discussion on cannabis and what's coming up in April, so the Association Municipality of Ontario, they have request from the province funding, not just for policing, but for policing and public health and education. So have we identified our portion? Because it's going by population, the $40 million based on the province about the population. So we are 1 million of population. So is there a number in the air where we expect that from?
That hasn't been identified, no.
No.
We don't, no.
Okay, thank you.
Thank you. And Member Giovanni.
So there's a similar theme around this part of the table. My question is around those assumptions from the Ministry of Health, and so I understand it's an assumption and you need to start somewhere. I guess my curiosity is this a standard planning assumptions that other boards of health in Ontario are using, around 2%, or are we higher or lower than some? And then in follow-up, with that assumed increase, does that cover the cost of living adjustments with collective agreements and inflationary, or does it mean actually cutting positions just to be able to stay within and maintain those salary levels?
Yeah, so the increase does cover just our cost of living. We're maintaining the service level, so it's based on the assumptions of cost of living increases and inflation when it comes to the lease costs and fleet. So in no way are we growing the program any. With respect to the other municipalities, I haven't taken a poll on other municipalities. I suspect that some might be a little bit more conservative, but if it was decided that if we don't ask for the money, then they won't provide it. So I think that 2% is relatively conservative. We have recent experience on that in terms of if it doesn't come, and so I think that we're well placed.
I could add to that, Chair. We had an increase last year from the province, and we've had increases in the City of Ottawa for our public health department, where other public health departments across the province have not, because we have been one of the lower funded health units per capita. So there was an equity-based funding formula. We don't know exactly how it worked. They didn't share that with us, but for a number of years we had increases where others did not, and we did have an increase last year. So that leads us to make our case again.
Okay, thank you for that. And I mean, I concur with what's been said, in that if we don't ask for it, we're never going to get it. So, I've certainly been briefed in great detail by staff on it, and I think the asks are not unreasonable. I think that the programs that we're looking to buffer and bolster and keep in place are all quite reasonable and all reflect needs in the city. So I'm hoping that the province will see that as well. Member Lakin, you're next on the list.
Thanks, Mr. Chair. Quick question, please, regarding revenues by type, page 4. Fees and services. It appears from what I'm reading that this is net negative revenue.
Correct. It was a reduction in one-time funding that we received, and so it should have probably been better reflected on the other line. We received one-time funding for a mental health initiative with the Royal Ottawa, and that program ended at the end of 2018, and so that's where you see the reduction in that revenue.
May I follow up with a supplementary question? Thanks for clarifying that. I thought it perhaps tied into fees for services provided by OPH, such as health inspection services, food handler costs, etc. Are those items net neutral or contribute to the OPH bottom line?
They contribute to the OPH bottom line, those additional revenues. Those revenues are, as you can see on the last page, there's inspection searches, food handler courses, contraception supplies. There's also fees for service there, which include OHIP revenues that we generate at our clinics, and all the the vaccine revenue that OPH collects when they administer the different vaccines.
Okay, thanks.
Maybe just to also strengthen that we don't ask people to pay for their vaccines or their OHIP fees. Those are then revenues from the province. So it's a different type of fee and service revenue.
Member Banham.
Hi. So there's a decrease in the funds for the Healthy Growth and Development Program, and no increase or decrease to the Healthy Babies and Healthy Children program. And knowing that early intervention helps support a healthy public and is a big part of prevention, I'm wondering, are we concerned that without the 2% increase, we might have further decreases in those pockets? And my second question would be, can you speak to how we're ensuring these services continue to meet the demand in the community?
So just to be clear, are you referring to, where is it here, Healthy Growth and Development? Is that the $40,000 reduction, or just?
I think it's the 145, unless I'm reading this wrong. Page 3.
Oh, healthy environments, page 2.
123. Oh, 123. Sorry. Yes. And then the 0
I believe
for Healthy Babies.
I believe that's an adjustment for one-time funding that we received related to breastfeeding support. Is that correct?
Yeah.
So it's actually not about a staffing decrease to that program. It's just recalibrating the budget because we had money come in for one time and then we have to take it out. Your other question about how do we continue to run the program and ensure it meets community needs is a good one. Our birth rate has stayed fairly stable, so we don't have a skyrocketing birth rate in Ottawa in terms of trying to keep up with that demand. But it's similar to other services where we know we could provide more and more support, that it's really almost endless, that parents could use more support. I certainly feel like that too. But the way we're approaching that is by looking at other options that really provide the right kind of support for what the families need. So more tailored to some families that need more support at some time. Others may find all they need on our website. And so it's really looking at prioritizing and adjusting what certain families get based on the risks that they're facing to the development of their child. And then trying to extend the ways we reach all families and work through partners. So there's evolution in Ontario to develop early on centers, so that will support parents in early childhood development. So looking at how we use those centers and build capacity of others to also promote early childhood development. There's an Ottawa Child and Youth Initiative, which brings together many sectors actually, which is appropriate when you think about takes a community to raise a child. So schools, police, many different partners around that table, and so again, that gives us the opportunity to extend the number of people and the services that are focused on supporting early childhood development.
Thank you very much. Are there any other questions from members? Okay, I just have one quick one. I think this is the very first question you were asked. I just get some clarification about the $200,000 that's sort of sitting there from the city. I'm assuming that that's our 25% contribution, if you will, if and when the province comes up with the money for additional programs.
Correct. We asked for base and one-time funding to the province when we put in our submission. Lately, the last few years, the province has provided funding for related programs, as they call them, and they've given us 100% funding for those programs. But there's been instances in the past where they provide funding for a program, but they want to cost share it. And so in order for us to get the city portion of it, we requested through the budget process, and it's contingent on the province providing us one-time funding. That's cost shared.
So if none of those cost share programs come through, what happens to that $200,000?
Those funds are returned to the cities.
Okay, thank you. Again, any other questions, comments around the budget? Dr. Etches?
If I may, oh no.
Oh, Dr. White?
A very quick question. Under legislative accountability agreements, is OPH permitted to create a reserve?
I don't believe we are. This reserve that we did create was based on with the city portion of our funds for the IT.
Okay.
Dr. Etches?
Well, I just wanted to thank Lou and Sam and team for putting together a budget. In short time frame, they're going to have to do another one because of the way the electoral cycle works, and it's a lot of work. A lot of detail goes behind the scenes, lining up every program with the funding required, and just really want to thank you.
I echo that, and I'm judging from the questions that we received in the comments that people are in favor, but we have to make it formal. So all those in favor of the budget? Okay, thank you very much. Next on the agenda is Let's Clear the Air, and I'm going to ask Jillian Connolly, the Manager of Healthy Communities, to come up, and Jillian's got a brief presentation for us.
Good evening, Chair and members of Ottawa's Board of Health. I'm here today with my colleague, Marino Francipillier, Program Manager of our School Community Mental Health and Wellness. I'm here this evening to present Ottawa Public Health's proposed approach to reducing harms associated with smoking of tobacco, cannabis, and vaping. With an increase in youth vaping in Ottawa, the misconceptions of the health effects of vaping, and the new legislation regarding cannabis, OPH is proposing an update to its Let's Clear the Air 3.0 action plan. As many of you are aware, the City of Ottawa was at the forefront of smoke-free policies in 2001, implementing some of the most extensive smoke-free policies at that time. 10 years later, Ottawa City Council recommended that we review these policies and update and expand smoke-free places in Ottawa. And as such, in 2012, Ottawa Public Health, with its partners, put forward a report, Let's Clear the Air 2.0, which recommended expanding smoke-free places and outdoor places, including parks, city properties, beaches, restaurant and bar patios. The plan also included activities relating to youth initiation, reducing youth initiation, and greater supports for cessation. 4 years later, Ottawa Public Health brought forward another report to further eliminate local gaps in smoke-free regulations. The board also submitted recommendations to the provincial government on its proposed Electronic Cigarettes Act and Smoke-Free Ontario Act amendments, and advocated to the federal government for stronger regulations for e-cigarettes. Based on the recommendations approved by the board, Ottawa City Council approved the water pipe bylaw, which prohibited water pipe use in enclosed public places. And now I'm here today to present Ottawa Public Health's updated 3.0 plan. Local data demonstrates that vaping among Ottawa's youth has surpassed tobacco use. In 2017, 10% of Ottawa students have used e-cigarettes compared to 6% who have smoked cigarettes in the past 12 months. This is in contrast to 18% of youth who have used cannabis in the past year. Our data also demonstrates that there are misconceptions about the health risks associated with vaping. Almost half of Ottawa students believe that regular vaping presents only slight or no health risks. This is in contrast to 71% of students who feel that smoking cannabis regularly carries a medium or great risk of health harm. Research also demonstrates that there are health risks associated with vaping. This includes vapor from e-cigarettes can contain particulate matter, nicotine, and toxicants. In addition, there are risks of nicotine addiction, as vaping products have significantly higher levels of nicotine. For instance, one e-pod may contain up to the equivalent nicotine as 20 cigarettes. Inhaled smoke delivers nicotine to the brain within 20 seconds, which makes it very addictive compared to opioids, alcohol, and cocaine. Nicotine is also known to alter brain development and can affect memory and concentration. It may also predispose youth to addiction to nicotine and possibly other drugs. Research also demonstrates that youth who use vaping products may start to use cigarettes. And finally, there's a need for long-term studies of the health effects of vaping, as there are still many unknowns about the long-term effects. Our research also demonstrates that the promotion of vaping products has been shown to influence youth by increasing their odds of being open to e-cigarette use and promoting high curiosity about them. Currently, promotion of vaping products through advertisement and other marketing forms, such as a store can use posters and displays inside or outside the store saying that they sell certain brands, as long as the poster remains informational and do not try to promote vape culture. Research also shows that banning promotion removes sensory cues to purchase and use these products and helps to denormalize use. In addition, in 2016, the Ontario government prohibited the sale of flavored tobacco. This, however, does not apply to vaping products, and systematic reviews have revealed that youth are attracted to vaping products, and it is an important factor in youth decision to use vape products. And so based on this information, we are proposing an update to our Let's Clear the Air action plan, which seeks to prevent initiation of smoking, cannabis, and vaping among youth. This work includes providing education sessions to younger kids, as well as equipping teachers, parents, and youth workers with information about the health harms associated with vaping and how to discuss vaping with youth in their lives. For older adults, OPH will support peer-to-peer groups in local high schools to prevent substance use and reduce harms associated with problematic substance use. This work entails a public health nurse directly working with peer groups in the schools to encourage youth to use critical thinking and media literacy skills to effectively communicate with their peers. Evidence demonstrates that peer-to-peer youth engagement strategies combined with education is an effective means to reach youth and improve health outcomes for youth. We're also proposing to protect Ottawa residents from secondhand exposure to smoking and vaping through increased enforcement of smoke-free provincial legislation at local schools, along with working with local landlords to implement smoke-free and vape-free policies. We're also seeking to reduce youth exposure to vaping products through addressing legislative gaps at the municipal, provincial, and federal level. And finally, we are seeking to increase coordination of cessation services in Ottawa, specifically those services that would support youth to vape. As noted, a key element is to address legislative gaps at all levels of the government. Municipally, as directed by Council in December, OPH will work with city partners to harmonize the city's current smoke-free bylaws. Through this work, OPH and its partners will seek to put forward bylaws with consistent and enforceable language that address smoking and vaping of tobacco, cannabis, and other substances. At the provincial level, OPH staff are recommending a number of recommendations to strengthen current provincial legislation. This includes prohibiting flavoring agents in vaping products, prohibiting point-of-sale advertising. This would include prohibiting marketing, purchase, displays, signage, and suggestive selling at the cash registers and other areas within the store. At the federal level, OPH staff have put forward a proposed submission to Health Canada's recent consultation on vaping advertising. Recommendations include restricting the placement of advertising on broadcast media and publications in alignment with current tobacco regulations. This includes prohibiting advertising and vaping products on all domestic television, radio, newspaper, magazine, and outdoor advertising channels. In addition to restricting advertising of vaping products in print media, the internet, and through internet sales. Staff are also recommending enhanced health warnings, as well as recommending plain and standardized packaging for all vaping products. In closing, while I am presenting our action plan to you today, we have started some work in this area. And before you hear are a number of our resources. So we have a parent vaping fact sheet about how to talk to your youth about vaping. A vaping myths guide for educators to debunk a number of myths that are out there. And as well, we're currently working with a number of youth to pilot test denormalizing campaigns for high school students. I want to thank you for your time, and I'm happy to respond to any questions.
Thank you very much. I'm going to start off the questions, if I might. One of the comments you made, Ms. Connolly, was that, I'm putting words in your mouth a little bit, but that the vaping is essentially a gateway to potential ordinary or conventional smoking. When people talk about vaping, they often talk about it in reverse, that it's that vaping is a way to give up smoking or to curb the need, if you will. Is that an urban myth that we're dealing with there?
There's sort of two ways of looking at this. So one way is that we're looking largely focused on youth. And so the research demonstrates that youth who are vaping, there is indications that they are more likely to try conventional cigarettes. At the same time, research demonstrates that vaping as a cessation tool hasn't been proven as an effective cessation tool. In addition, Health Canada has also not regulated it as an effective cessation tool. Having said that, where we stand is that individuals who are looking to quit smoking, they should be having a discussion with their healthcare professional and determining the best effective method for them based on their needs in terms of should this be an effective means for them.
And in terms of the companies that are producing the product, are we effectively seeing a bait and switch? Are these the cigarette companies moving into the vaping industry? Is that how it's working, or?
Based on the information that we have currently, yes, that is a large portion of the companies who are producing vaping products are the same big tobacco companies. So
it's essentially the same product, just packaged in a flashier way.
Yes.
Okay. Thank you for that. Again, I'm going to put together a list. I'm hoping that the recommendations of the report are supported by all the members. Ottawa has been a provincial, if not a national leader in terms of smoking bylaws, smoke cessation management. And again, I think I use the term bait and switch. I think this is just, we've been so successful that companies in the industry are trying to find a way around and to make smoking attractive again. And I think we, especially to our youth, we owe it to them to take these steps. Two of the steps involve a letter coming on behalf of the board and on behalf of the city to both the provincial and the federal governments to urge them to do everything they can within their levels of jurisdiction to assist us in dealing with this problem. So again, I would hope that the support is there. I'm now happy to put together a list if any members have any questions. Member Couchet.
Merci, Monsieur le Président. So, forgive my ignorance. Am I to understand that is it tobacco leaves that are in vaping products? Or?
No, it's not tobacco. For the most part, many vaping products don't include tobacco. They include, there's a wide range and there's a huge difference between which products you're using. One of the most popular products, they include what's called an e-juice, and it has polypropyl glycerine in it in addition to having nicotine. So it's like a liquid that's being combusted, and then vapor products are coming out.
Nicotine is present in tobacco. How does the nicotine get into this product?
That's probably an excellent question in terms of the chemical elements of it. I don't know if you...
Through you, Mr. Chair. So the nicotine itself as a product is being extracted and being used in the e-juices, but it's not tobacco. In fact, for that reason, it can't be taxed like tobacco can.
Okay. As part of, and I see our recommendations in the report to the provincial and to the federal government, should part of our recommendations, I beg your pardon, be that we ask the federal government, I presume it's under federal jurisdiction, to find a way to restrict the amount of nicotine that manufacturers are allowed to put into this product, or to make it abundantly clear as to the level of nicotine that is in the product.
What we're aware of, it's an excellent question, and it is something that we are looking into. What we are aware is that Health Canada, similar to this consultation that they released, they're intending to release another consultation, and that's one of the elements that, based on our information, would be included in that. And so I would recommend that is something that we have thought of, and we would be recommending to be included, and it could either be included at this time or at future times.
And just to finish, the manufacturers are inserting nicotine just for its addictive purposes. There is no other redeeming quality of reason to inject nicotine.
I can't really speak to the practices of the company. I mean, I just...
Okay, thank you.
Member Gower.
Thank you, Mr. Chair. I have a daughter in grade 8 who attends a middle school, and I told her last night that this is one of the items on the agenda, and she was very glad to hear that. It's an issue for kids as young as in grade 7 and 8. I had two questions. One is in terms of statistics on vaping for those younger grades, is the are we seeing a disproportionate amount of users in grades 7 and 8, for example, compared to smoking? Is there any difference between the younger grades and the older grades, you know, grade 9 to 12? And the other question I had would be, at this point, our strategy around education and awareness and the intervention to reduce youth vaping, how young are we going in terms of when does that discussion start in elementary grades, for example?
I'll start with the second question while we're looking up your first question. So your first question was, at what level do we start the discussions? And so what our public health nurses do when they go into the schools, our information that we share with them aligns with the curriculum. And so tobacco use starts in grade 4, and that's when we start the discussions at that time. So grade 4 to grade 7, it increases, like you're talking about tobacco, then you might be talking about additional substances. And so as the kids get older, but tobacco is one of the first substances that they use. Did you want to answer it then? Sorry, I haven't read it.
And then to your first question, just in terms of how many people are vaping, most recent studies point to 19% of grade 9 to 12 students are vaping or have tried vaping.
And does it get as specific as grade 6, 7, 8? Kind of data?
I can speak to just what we're hearing from our partners from the school boards, and they are seeing it in younger ages in the experimentation stage.
Okay, thank you.
Yeah.
Are there any other members? Member Menard.
Thanks very much, Mr. Chair, and thanks for your presentation. The legal age for vaping is the same as buying cigarettes. And so obviously we're seeing an uptick, not because of the legality of it, it's because of the attraction to the product. You mentioned one thing that we could do is harmonize our bylaws, and we've had a conversation about this. Thanks very much for that. But what would that look like, us harmonizing our bylaws to make sure we're including, I guess, vaping with all the other forms of smoking that we've already got in there?
So there's sort of two questions a little bit in there. I'll address the second one again first. So in terms of the harmonizing, what it would look like is there's currently 8 city bylaws, and their definitions of smoking is very non-consistent and don't uniformly include tobacco, cannabis, and vaping in them. And so what we're looking to do is create a space definition that would be inclusive of all of those, as well as other substances. And that's what we'd be looking for, the harmonizing, so that there's a common understanding of the definition of what's included in all 8 of those bylaws. And to your second question about the age, that's, I can ask our legal staff, but I don't believe legal age is within our own municipal jurisdiction.
Okay, that's very helpful. One of the things that we've discussed is around our school boards and how we can further integrate within our school boards and the teaching that goes on there within health curriculum and otherwise. If there's areas outside of sort of the bylaw harmonization that counselors can help with in terms of schools in their areas, it would be great to get, if there's materials or things we can help push and promote. I think that would be helpful. Lots of families in my area anyway, and I know that there's a concern there with seeing an earlier age of trying this type of product. So it'd be great to get some more information to get out to our schools.
Any other members with questions? I have a follow-up question, because one of the things that you indicated in one of your answers, which I found very interesting, is that vaping products are in fact not taxable as cigarettes are. Is that correct?
Because they're not considered tobacco products, it's not taxed under the Tobacco Taxation Act.
Even though the nicotine is extracted from the tobacco?
That's right.
Interesting. So I believe on one of the slides there's an indication that one of the e-juice pods can hold the equivalent nicotine of 20 cigarettes. So essentially a pack of cigarettes. What's the delta in cost between if I bought a pack of cigarettes versus buying an e-juice pod?
Cost?
What's the difference in cost?
So just to give you an example, there are different types of pods because there's many different types of vaping products. But one of the most popular brands out there, their pods sell in 4-packs at $20.99 for a 4-pack. And each pod could have up to 20 cigarettes worth of nicotine.
So $21 for essentially 4 packs of cigarettes. And a pack of cigarettes now costs?
10 to 12.
12. I look to the clerk as I say this and my colleagues, but could perhaps one of the recommendations we put in the letter is to ask the various levels of government to look at the possibility of taxing vaping products in the same way as they tax tobacco products. I look to the clerk as to how we amend the report to reflect that.
Yes, through the chair, there could be a motion brought to recommend that essentially the letters, 2 letters, both the letter to the province as well as to the federal government, include the specific recommendation that the respective governments look into adding taxation for nicotine products that are used in e-cigarettes.
Now, do I have to leave the chair to make that motion, or?
The chair or any member of the board may bring that motion, yes.
Okay, Member Lakin, if you want to make that motion, I'm obviously happy to support that. Can we have that motion drafted up?
Certainly, yes.
Well, sorry, Mr. Chair, we're talking about the motion now. So the motion is on the floor now, right?
Right. This would be an amendment.
Well, so when we talk about the amendment, so instead of asking 2 levels of government for taxation and leave it alone so they can make taxes on it, maybe should amend that motion to say any revenue from those should go back to education in the sake of public health, perhaps. Just taxation for the sake of taxation, I think government will welcome that. Oh yeah, that's more revenue. So that's what they legalize and
that's fair comment, and I don't have a problem with that. Member Lakin, I don't think it's a problem either. I was thinking of taxation more in the sense of being preventative. If you had to pay the same price, that may have an impact, but your point is well taken. And if that can be incorporated into the amending motion as well. Member Banham?
Sorry, this is potentially an ignorant question, but what's the equivalent of 1 e-pod 220 cigarettes? Is 1 e-pod going to last you 1 use, or is it going to last you 1 month? I mean, obviously there's usage, but if you could tell me what the equivalent is?
Yeah, we were looking into that and trying to determine numbers in terms of what's the very basic statistics, and it's kind of asking, akin to asking like how long would a pack of cigarettes last, and it's very different based on the users. And so there was some research demonstrating that individuals who use the e-pods with a higher nicotine, they're using more often, so they might go through a pod to 2 pods a day. But it very depends, and it's obviously that statement, that one data point that we have, also links back to it being addictive. So if individuals are using e-pods that are less addictive, they might be using less e-pods.
Yeah, I guess the root of the question is that if I'm a 15-year-old and I'm going out on lunch break, I'm probably not smoking 20 cigarettes. But if I have a cherry-flavored e-pod, I might just keep smoking or keep vaping that all lunch hour, and would that equal 20 cigarettes by the end of lunch?
Yes. Yes.
Any other questions while we wait for the motion to be drafted? I have another question. So one of the things that I've seen amongst youth is the sharing of one vaping, I don't know what you call it, device, tool. Aside from the obvious of sharing, but are there any inherent health risks in me taking my vaping device and sharing it with 2 or 3 other people?
That's actually a common question that we do get about the vaping, about water pipes, and then joints as well. And so there are health risks that could be that are inherent in sharing some of those. So often our messages for the cannabis with joints is share with care. So there are elements that could be causing you to be passing on diseases at that point, should one individual have that.
So there are risks over and above the nicotine intake. Okay. Again, I think we're almost there. If we can just take a break for a second.
It's health promoting to stand up every once in a while and not sit all day, so go ahead, everyone.
So if everybody could take their seats, please. I think we still have quorum. So I'll read the motion that Member Lakin has agreed to bring forward. Whereas tobacco products sold within Canada are subject to a tobacco tax, and whereas e-cigarettes that contain nicotine products are not subject to a nicotine tax, therefore be it resolved the letters referred to in recommendations 3 and 4 respectively include the recommendation that the appropriate level of government introduce taxes on nicotine products and ensure that corresponding revenue be directed towards education programs about the harms of nicotine. Okay, well, all right. Dr. Etches has pointed out, Member El-Chantieri, that that's quite a specific ask that maybe we could. Do you have some wording, Dr. Etches, that would?
That was the purpose of it, toward education, but that's fine.
Be directed to public health programming.
Yes.
Okay, that's fine.
I was telling the chair, I've been around in the retail business when Government tried both. One, to increase taxes, which is, it didn't work. Then people start buying the illegal product. And once they tax it, and they benefit from the taxing. So we need that taxation to go for public education, public health education. That's what I'm looking for.
So, so the motion with the, to amend the report as amended by Dr. Etches. Thank you for that. Are we all in favor? So, and to accept the report as amended? Carried. Thank you. Next, we have Ottawa Public Health's submission to Health Canada on proposed regulations for cannabis edibles, extracts, and topicals, which is kind of an appropriate segue, I think, after what we just discussed. We don't have a presentation for this, but I thought that members might have some questions for staff around this.
Maybe I'll start the question
Sure.
with this one, if I may. So, in the past, during that discussion about the cannabis and the edible, one of the biggest concerns, so when someone smokes and go behind the wheel, we send police for training and equipment and to be able to identify the individual driving under the influence. With the edible, I'm curious to know, has any development how we're going to identify the person who's eating this sandwich or brown, whatever, how would we identify this under the influence?
Thank you, Councillor, for your question. It is the same testing that would be used and the same elements that the police would have, the same tools that the police have to do for the smoking would cover the edibles as well.
Well, you know the challenge, if you see somebody smoking cannabis or something, maybe it'd be a lot easier to identify than a person eating jujube. And I know there's no secret how much testing will cost, and that's why a lot of government agencies avoid testing a lot of product in the past. I don't have to remind you about the shisha and the water pipe, some of it herbal, some of it tobacco, some whatever, and we stopped testing because every test costs $3,000 to the taxpayer. So my question is, if someone eating jujubes and acting a little bit high on sugar, is it going to be calling the police and do the testing? That's what I'd like to know.
Are you, just a point of clarification there, are you looking at whether the police have the capacity to test individuals who are consuming, or about asking whether there's a capacity for the police to test the products themselves?
Well, both, because...
Okay. The police have the capacity to test an individual to determine whether they have consumed elevated levels of THC and then are driving. And so the police would use the same sort of process that they do for driving drunk, but they have different tools to determine. In terms of determining whether a product contains THC levels, that's still a bit of an uncertainty at this time, and it is something that we've had some discussions about to determine what does that look like, how would people determine that, and who's under whose authority are elements like that being assessed. And I think that that's why we've been putting some of our recommendations forward, and one of the biggest recommendations is that each product be stamped with THC. So should those recommendations be approved and someone comes across some gummies and the federal government have implemented the recommendations that we've put forward, that they're stamped, it would be clearly identifiable, and then you wouldn't have that kind of gray zone that you're talking about.
Well, my faith in the federal government doing this is very slim, but nevertheless, the biggest concern when we talk about the edible product is how easy it could be is dealt with from the underworld, like not the legal stuff. That's the concern, and so we go back to the testing. Who is going to do the testing on the product itself? Not when somebody's driving, not when somebody's acting high. Just how are you going to do if this product is contained or not? That's what I'd like to know. Where the testing's going to be.
I think that's a good question that at this time there aren't clear answers on.
So basically, we don't have an answer for this at this time.
Well, the police are responsible to enforce the law, and if they take some product in as part of that investigation into an illegal product, then they would have to use their investigative methods to test that product.
But we're facing the same thing, doctor. I mean, the testing of this has to be going to a lab, and the lab is in Winnipeg, and the cost of this is huge, and there's no money coming with the legalizing of the edible. That's why I'm trying to make a point, basically. So we understand it's going to be a very big challenge, whether for policing or public health or other, or even school, to identify what the kids are eating at this point. And I understand the legal is going to be stamped by the federal, but it's a lot easier to smuggle illegal candy than in the past, so that's the concern we have.
I think part of the bigger part of this report, though, Member El Shanturi, is about our youth, and similar to the discussion we just had about candy flavored and what have you, is to ask the other levels of government to work with us to create a scenario whereby you don't make these products attractive to youth. So you don't market them as gummy bears or a knockoff of a very popular chocolate bar or something like that. I see where you're coming from, but I think the bigger piece of this report is to get a concerted effort at all levels of government to advertise this product as it is, not to gloss it over, not to make it fun and pretty and everything else, but to attract kids, but to simply, put it forward as it is. So I think that's a very valuable piece of the recommendations going forward. Member Lakin.
Thank you, Mr. Chair. A question on recommendation 2 contained in the letter to the Ministry of Health regarding labeling. And as it stands, the recommendation recommends labels are required to have a health statement about delayed onset and about toxicity or overdose or poisoning, with a list of requirements itemized. I wonder if there's a case for the recommending a more concrete guidance statement about use, requiring that labels have information about low-risk use is certainly useful, but I wonder if, given our particular concern about youth and general users, whether a more concrete guidance statement, similar to what you might see with over-the-counter medications, might be worthy. I don't have the language for that, but essentially take one tablet at a time. If you don't feel something, wait. This kind of language, whether something more concrete in the guidance might be worthy of consideration.
I think it's a good statement, and I think it's probably what you're being a little bit more concrete than we were being, because the low risk guidelines, one of them is start low, go slow. So those are that could be the statement that would come out of that, and that's one of the recommendations in the cannabis use, low risk cannabis use guidelines, in that recommending people to kind of just what you said, that you need to start, wait, delay onset, acknowledging that, and I think probably your statement is a very pointed statement that would be hugely beneficial to be included in there.
I guess I just want to emphasize that in the language of the letter with recommended requirements, that we're clear about the health messaging and the need to be concrete in that health messaging.
I would interpret that as agreement with the principal to convey the low-risk cannabis use guidelines, because the statements you've made are included in the cannabis low-risk guidelines, so it's in support of the recommendations, it would be an additional point of clarification, or we could look at adding that particular key messages from the low-risk guidelines also be considered for the packaging.
Any other members with questions about this report? Member Banham.
So I'm in full support of all the recommendations, but I have a bit of a reality question. From my understanding, many of the products available in storefronts to date are products that mimic other candies or chocolates or whatnot. And from my understanding, the legalization of cannabis is to try to ensure that people using cannabis are using verified safe products. So if the legalized products are unable to provide a similar experience to what is available in the community, will people use legal cannabis, or will it further people's usage of illicit product?
Thank you. I think that's a fair question. So I think what we're describing here is to limit things that appeal to children. It doesn't mean we're asking that all chocolate products or all sugary sweet products be eliminated. It's to do with how they're packaged and how they're mimicking other things that children like. So there could be products still that are appealing, that fit some of those categories that people like, sugary, for example, that are still not as appealing to children.
Any other members with questions? Okay, thank you. And so can we receive this report? Sorry? And also carried as well. Okay, thank you. Item number 6 is the update consultation on opioids, substance use, and mental health. Oh, we received that on consent, correct. So under information previously distributed, we have the update on the New Canada's food guide. Received. Member Pinnell, could you move the motion to adopt reports?
Thank you, Monsieur Président. First, a motion regarding the 2019 draft operating budget for the Ottawa Board of Health. That the Board of Health for the City of Ottawa Health Unit approved the 2019 draft operating budget for the Ottawa Board of Health outlined at document 1 as follows. Page 5, Ministry of Health and Long-Term Care Programs and Standards, Chronic Disease Prevention and Well-Being, Food Safety, Healthy Environments, Healthy Growth and Development, Immunization, Infectious and Communicable Diseases, Safe Water, Substance Use and Injury Prevention, Foundational Standards and Emergency Management, and Program Support. Also on page 5, Supplementary Programs, Healthy Babies, Healthy Children, and Dental Program. Page 5, City-funded programs, mental health, substance use and injury prevention. Page 5, provincial programs, AIDS Bureau, supervised consumption services, IT reserve fund contribution, and page 8, user fees. Upon the Board of Health's approval of the 2019 draft operating budget for the Ottawa Board of Health, direct staff to forward the report to Ottawa City Council for consideration on March 6, 2019, as part of the City's Council approval of the City of Ottawa 2019 draft operating and capital budget. And upon approval of the 2019 draft operating budget for the Ottawa Board of Health by the Board of Health and Ottawa City Council, direct the Medical Officer of Health or delegate on behalf of the Board of Health to forward the 2019 Annual Service Plan and budget submission based on the approved 2019 operating budget for the Ottawa Board of Health and the Ministry of Health and Long-Term Care for consideration.
Thank you very much. Carried. And now the motion to adopt reports, please.
Il est résolu que le rapport verbal du président du Conseil de santé, le rapport verbal du médecin-chef en santé publique et les rapports intitulés « Budget provisoire de fonctionnement pour 2019 pour le Conseil de santé d'Ottawa », Plan Purifions l'air 3.0, soumission de Santé publique Ottawa au projet de règlement proposé par Santé Canada sur le cannabis comestible, les extraits et le cannabis pour usage topique et mise à jour, consultation sur les opioïdes, la toxicomanie et la santé mentale à Ottawa soient reçus et adoptés.
Adopté? Okay. Any motions requiring suspension of the rules of procedure? No, thank you. Any notice of motion for consideration at subsequent meeting? Thank you. Confirmation bylaw?
Be it resolved that Confirmation Bylaw number 2019-2, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting on March 4, 2019, be read and passed.
Carried. Okay, thank you. Any inquiries? No? Adjournment? Thank you. Our next meeting will be April the 15th. Same time, same place. Thank you.